Hi there, it's Dr. Maher from Highland Pediatrics. I wanted to chat about a developing condition called pediatric multisystem inflammatory syndrome that has been in the news lately. This condition goes by the acronym PMIS, PIMS, or MIS-C, and is being studied in connection to COVID-19. And if you watch the news or read the internet, you may be startled by this new mysterious sounding condition. So what do we know about PMIS as medical providers? Well, we know that this process is similar to two conditions we studied in our first years of medical school called Kawasaki disease and toxic shock syndrome. These two conditions are not new to us as medical providers. In fact, we already routinely ask questions to specifically screen for these conditions when we're in the office together. We have experience in diagnosing and managing these conditions through years of training in the emergency room, pediatric intensive care units, and every day in our office. While the definition of PMIS is unique to COVID, the overall features are not new to us. So what is PMIS actually? The condition develops in children about 4 to 6 weeks after they've developed COVID-19. And they present with a grouping of symptoms such as a fever for more than 3 days, abdominal pain, vomiting or diarrhea, rash or changes in skin color, trouble breathing, confusion, conjunctivitis, lymph node swelling, sore throat, swollen hands or feet, passing out, or they're really cranky. But let's go back to that fever. It's important to note that most of the fevers that children will have this year are going to be from common viruses and not PMIS. And it's really a combination of those symptoms that we talked about above that make up the constellation called PMIS. And compared to other general viral illnesses, children with these conditions tend to look really, really sick. So if your child has just one of these symptoms above, don't panic. Just give us a call to discuss. But how common are multisystemic inflammatory syndromes anyways? PMIS, like Kawasaki's disease and toxic shock syndrome, are actually really quite rare. At Highland, we see about 1 case of Kawasaki disease a year. And for PMIS, of the 343,000 patients in New York City diagnosed with COVID-19, there were only 110 cases of PMIS reported in children. This results in 3 cases for every 10,000 people diagnosed with COVID. Let's bring it closer to home. As of May 15, 2020, for all the 5,440 people diagnosed in Bristol County, that would mean there was only 1.6 cases of PMIS. Analysis of PMIS suggests that it actually comes in clusters. And right now, we have not seen any cases in our area. And to speak about coronavirus and our children, in Massachusetts, only 53 children under the age of 18 have been hospitalized. And Massachusetts has not reported any pediatric fatalities from COVID-19. So we will do what we do every day as parents and medical caregivers. We will be calm, but we'll be vigilant. The practitioners at Highland Pediatrics have close to 160 years combined medical experience. We are committed to educating, caring for, and keeping the children of our community safe. If you're concerned about PMIS or anything else regarding your child's health, please reach out. At Highland, we have developed a variety of ways to take care of your children, including video visits in your home, in-person appointments at the office, and even, in certain circumstances, we perform exams at our parking lot. Please keep tuned to our Highland Pediatrics Facebook page and our website for updated information. From the Highland Pediatric family to your family, please be well.